With that, we would like to proceed towards the next discussion. The topic is See Your Future Health Now, How Imaging Unveils Your Wellness Potential. The session will be taken by Dr. Harsh Mahajan. So I would like to request you all to please put your hands together for the gentleman, because we are looking forward to hear some words of wisdom from the gentleman.
Thank you very much. I think it's been a fascinating day. We've come from the soul, the mind, the body, and frankly, I don't know about the soul, but the mind certainly. With imaging, we can see, and a lot of work that we've done actually here in Delhi, because meditation is part of the ethos of this country, of this city also. And using functional MRI, I'll come to wellness a little later, but just to begin, because we had this wonderful talk on the soul, body, and mind, and how, from the bottom up and the above down approach and how they need to merge. We can, using functional MRI techniques, actually study consciousness. We can see what happens in those who meditate. We can see the effects of Om chanting. And we've done these in our center. And it may not surprise the practitioners to know that with Om chanting, with meditation, you have depression of the hypothalamus, something which happens when we give anesthesia or sedation. So the mind is open to us. We heard Peter just now talk about depression. And the world is searching for objective biomarkers using functional MRI for depression. Still not there, but the search is on. And would it be possible for us to know that is someone actually depressed based on certain parameters that you're able to see on the MRI? And this is not just structure. This is going beyond that, studying functional. So functional medicine, functional imaging, both can correlate. And I would say the work for this would need to be done perforce in this country. The other way is, and we've done this with the meditation practitioners about 15 years ago, when functional MRI techniques were not so good, using brain SPECT scans. And these gentlemen used to fly in from Bangalore. And then when you compare their brain function with that of the controls who don't practice meditation, you can see vast differences. Differences also with literacy. Illiterate women, and this is something which is an ongoing project with the Max Planck Institute, where illiterate women, given an intervention of 4 months of teaching, they learn to read and they learn to calculate, and which new areas of the brain open up. And micronutrient supplements, actually this is a project we did about 8 years ago with GSK, where actually the ingredient was Horlicks, and they added Brahmi to it. Brahmi, we believe, is good for brain development. And this was given to children between the age of 10 and 12 years who had never had supplements before, so they did belong to the lower socioeconomic strata. 6 months of intervention, and then we did functional MRI before and after. Unfortunately, either Brahmi doesn't work or the intervention was too little, too short a time for us to be able to show appreciable differences. But this is something that is possible using the technology that's available with us. Having said that, in this realm of ageless living and living disease-free, what really is the way that diagnostics can help? in determining, in picking up disease early so that we can treat it, we can eradicate it. We all have learned since our school days this term, prevention is better than cure. That's so very correct. Prevention also happens to be much cheaper than cure. And if we are going to have healthy living till late in our lives, and many of us who are in our 60s now and have had parents who in the last 2-3 years of their life were not as healthy or as mobile or as disease-free as we may have wanted them to be, know, especially with everyone living to 90, 95 years of age, the last few years are not something you want to go through, to be dragged through. And recently we heard of a premier and his wife of Sweden who actually, both took their own lives at 93, euthanasia, which was legal in that country because they didn't want to go through. So what is the way? We have blood tests, which we can do, a very simple test, done early in life, and it would surprise you to know that even children have diabetes. Simple blood sugar, done early enough in life. Blood pressure, checked when you are young. Just those two simple tests can pick up a lot of people early on in life who may go on to develop diseases which have already caused irreversible damage if picked up early. Also, most of us go through an annual health check, and the age has come of personalized health checks. We have this silver and gold and platinum health check, and the rich will go for the platinum, and then you want in your companies, there is also a mandate from HR that you must have everyone do a health check. There you will go for the cheapest. But are we actually trying to diagnose things early enough? Are we doing the right testing? So many times we hear about friends and acquaintances, someone having had a health check done 5 days ago, and today he dropped dead. So this is the era of personalized health checks. Of course, there would be a little minimum of blood tests, a little minimum of ultrasound or X-ray or ECG or echo or whatever the case may be, which would be common across everyone. But as we heard today, every human being is different. And so, beyond that, one needs to look at a person's genetic history, family history, history of past disease, history of present illness, if any, and the problems one may be having, maybe a high blood pressure or diabetes or something like that, and then tailor the test, tailor the entire health check to that extent. And then based on what you find as the results, maybe a step 2 or a step 3 may also be necessary. Just going through a regimented scheme may not be enough. We heard of genetics and epigenetics, and we have a lot of genomic testing, which is now available in this country. We know, especially, many people will want to ask this question: do I have cancer today? And the next question: what is my risk of getting cancer as compared to the population at large? Am I at higher risk or not? And we know if there is cancer in the family, and especially multiple people having it, breast cancer in women, if your mother has breast cancer, your sister has breast cancer, or your aunt on your mother's side had breast cancer, then your chances are higher. And in India, you'll be surprised to know, women living in the urban environment have twice the risk of breast cancer as those living in rural areas, irrespective of their genetic makeup. Alcohol intake, obesity, all of these increase the risk. And also through genomics, we can find out. So the answer to those two questions, and I was talking to Arjun just now, and he was saying people are going all the way to LA to get that testing done. And I said it's available in Delhi. Why do they need to go to LA? So to answer the question, number one, do I have cancer today? What is being done is an MRI scan of the whole body. And there are, and this is about a 1 hour, 50 minute or a 1 hour scan, which can pick up early cancer if it is there in the body, and using genome testing for cancers. And already there are more than 100 actionable cancer genes that we know about, and there's a 523 gene panel that's available. That's the largest that exists, through which you can know what are the mutations that you carry and whether they make you at higher risk for development of cancer. And why do we want to know this? If you are at higher risk, say a lady for breast cancer with BRCA1, BRCA2 mutations, and everyone heard of Angelina Jolie's case, where she was at 80% risk of getting breast and ovarian cancer. And so she did preemptive surgery. She says, I have 5 children. I cannot take the risk of dying. So with that, what happens? If someone is at higher risk as compared to the general population, then you do screening that much more regularly, that much more stringently, so that cancer can be picked up early. We do know that cancer picked up in stage 1 or stage 2, it's a cure. Stage 3 and 4, it's a struggle. And it can be prolonged, there can be so much of suffering, both of the person who gets it as well as the family, apart from the expense involved. So there are technologies available today, and if you are able to do this, you will be healthy till later in life. Maybe one dies from some other cause. Similarly, we started with the brain, and in the brain as well, there are tests available which can actually find out whether you have a chance of developing Alzheimer's disease 10 to 15 years before the symptoms actually start to manifest. That's mild cognitive impairment. Even that, we can preempt that using a brain PET, and there are some specific other tests. There's no time to go into details of that. For the heart, calcium score, that's something we know that's been around for nearly 30 years using a CT scan. And about 20 years ago, we started CT angiography, which is an intravenous injection. And you're able to see the arteries of the heart. You can see whether there's deposit of plaque within. You can see the calcification. You can see how much is the narrowing. And so especially those who travel around the world, for them, it's important to know whether your arteries are clean, whether you do have plaque, whether there is narrowing. One statistic which may surprise some of you, out of all people who die of a heart attack, 50% die in the first heart attack. And 50% of those die in the first hour of the first heart attack. And that is because you're unable to recognize. Most of the time one feels this is acidity, and you pop in some pill for that, or have some Digene, and one is dead. So this is another way, knowing what is actually going on inside to determine. And then there are other ways. Someone has a 70% block, someone has a 50%. Whether that's even enough to cause a problem of the heart, there are other tests which can be done, a stress echo or a stress thallium. Then the liver. And in this country, and especially in North India, we believe a fatty liver is normal. Grade 1 fatty liver, I think all of us have, considering the diet we have and curcumin, we have a lot of green chilies. That actually has plenty of those. And so here again, very, very easy on ultrasound, the kind of ultrasound machines that are available today, to be able to quantify liver fat. Of course, MRI is the gold standard for that, but ultrasound does a good enough job. And also, if it's going into fibrosis, if you can find it in stage 1, you can reverse it. Early stage 2 also, there are drugs now available which can reverse it. So we can look at this. The microbiome, as yet, imaging can't show it, but I'm sure the day is not far when something or the other will get available. And a simple test, occult blood in stool, can pick up early cancers. And this is something which gets missed. So what I would like to say in the end is that currently all systems of diagnostics are working in silos. You have a lab where the blood is done. You have another lab where radiology imaging is done. A third lab where genomics is done. The future, as has been said about integrated medicine, integrating different aspects, functional medicine, Ayurveda, allopathic medicine. Similarly, the day has come for integrated diagnostics, because you, as people, don't care. You need a diagnosis. You don't care whether 5 tests in different parts were done or in different labs were done. You finally, and not only you, your physician also needs one comprehensive diagnosis. And these are all vast fields. We did set up 2 years ago a Center for Integrated Diagnostics in SDA in Delhi. It is a challenge to put all the various tests with their humongous data together. And that's where probably artificial intelligence is going to be playing a role in helping digest all the information and make it easier for your physician to understand it and then take action based on that. So congratulations, Arjun, for this wonderful, wonderful 2 days, and wish you all the best. Diagnostics is the bedrock for healthy aging, healthy living, and I think somewhere we tend to be reticent about it, and there are many of us who will say, I just don't want to know. But that, I think, is a defeatist attitude, because if you want to live healthy and age healthy and live long and healthy, there's no way you cannot get away from getting these tests done. Of course, only those that are necessary, and not a whole complement just because it's cheaper to get 500 tests done than the 5 you actually need.
You briefly mentioned about AI, and we know that at least you have plenty of data over the last, 3 or 4 decades of seeing all of us, whether it's for our TMTs, whether it's ultrasounds. Is that really happening in India? Because I know it's happening in the West. So that is why some of us are looking to go to, say, Los Angeles or New York to get a whole body MRI, because functional medicine gurus across the world are saying the same thing as you just mentioned, that detect it early, detect it fast so that we can treat it, because you want to reach the situation where functional medicine is allowed to give an opportunity to treat before you only need chemo and radiation. You see, that's the thing. Functional medicine works better if it's caught really early on. So, and AI can play a big role.
So thank you very much for this question. A lot of work on AI in imaging is happening in this country. You'll be happy to know that the first paper ever to come out in the Lancet on AI was from India, from our group along with our collaborators from Mumbai. And this was on head CT scans and AI being able to give reports on that. Also within Mahajan Imaging and Labs, we've spawned a AI startup, which was a thought leader in saying that AI for hospitals and diagnostics would require a platform approach. This is 2018. And we wrote about it, and there's plenty. So, and currently, our startup, which my son runs, which is called Carpool.ai, it's actually a US registered entity with a subsidiary in India. That platform runs at Harvard, Stanford, Thomas Jefferson, Emory, Yale, and is in the process of being commercialized now in the US, Australia, Singapore, and Brazil. Carpal, CARPL.ai. And there are a lot of small 2 people, 3 people, IIT people, some physicians, and of course the institutions, the large academic institutions, IIT Madras, IIT Delhi, Mumbai, who are doing a lot of work in this, both in developing the AI algorithm and also the concepts. What we did was to take, we are trying to be a marketplace to take AI and deploy it through a platform in different hospitals of the world. But a lot of work being done. There's no functional MRI with AI anywhere in the world. So functional MRI, we are able to interpret it. We don't need AI to interpret it. It is, resting state fMRI is here in this country. Anything that is done in the West is here. As yet, no one has developed an AI tool to interpret functional MRI. There are AI tools which are available for looking at brain volumetry, different parts of the brain. Is there shrinkage? Is there a specific part of the brain that's shrunk? What is the volume? What was it a year ago? What is it now? All those are available. But functional MRI per se, as yet, to the best of my knowledge, there is no tool that is there. We do have an open MRI also, but that is more for the spine. It does the brain, it doesn't do the abdomen, chest. But I think currently we'll have to live with the tunnel. The tunnel, of course, has become wider. So we do have wide bore MRI systems, which are much more comfortable for a patient. But if someone is really claustrophobic, then they say, "Doc, don't even close the door." That's how claustrophobic they are. And for the really claustrophobic, when you do need it, then we have to sedate. There is, though the open MRI is there, which is not a tunnel, which is good for the spine, it's good for the joints, it's good even for the brain, but can't give you that level of resolution which may be required in certain instances. What I know from Noora is that they do a whole body CT scan. No one does that anywhere in the world. You're giving radiation. That's why you do whole body MRI. And I believe they do a calcium score. Calcium score is step 1 for looking at the coronary arteries. When we do a CT angiography, which I believe they don't do, which requires injection of a contrast, then the calcium score is step 1 of doing that. I would rather do an ultrasound of the abdomen, which is better than doing a plain CT scan of the abdomen, which can miss anything. And that's radiation. It's only in the lungs that a CT scan is better than an MRI. And in the lungs, especially those at high risk for cancer, there is low-dose CT that's available, which is in the US. There's a program. They do it annually to pick up lung cancer early. But otherwise, it was 15, 20 years ago that we used to do whole body CT as a health check. They're not done any longer.
With that, thank you so much, sir. Thank you
very
so much.
much.
Everybody, please give it up for the gentleman, everyone.